Your health this afternoon. It feels like this year's allergy season is just getting worse and worse. So joining us now to discuss how to survive is Dr. Schuman Tam with Marin Health. Hi, doctor. Thank you so much for joining us here on Cron 4 News at 3.
Hi, everybody.
Why does it feel like allergy season is so much worse this year than it's ever been before?
Well, with the heavy rainfall, we have the past 3 or 4 months, the pollination, the grass and tree pollination are extremely high. So if you have existing hay fever, it tends to be worse this year with all the high pollination of the pollens.
So what pollen is the main culprit for allergies right now?
Right now, juniper tree, pollen, oak tree, and grass start to become a problematic pollen too. And it will get worse in next month.
Next month? Why will it get worse next month?
Well, the grass tend to be high at that time. So it's starting, and then it will get worse.
So what allergy medicines do you recommend that people try? Is there something holistic they can do? I think staying inside with the windows closed might work, but you can't live your life like that, you know?
Correct. In addition to closing the window if you can, or when you're driving, close the window, use the air conditioning. You can try over-the-counter antihistamine. I suggest using non-sedating antihistamine like fexofenadine or cetirizine. That they are very safe to take. And if it is not helpful, then you might have to use some nasal steroid spray like fluticasone or triamcinolone. And you have to use it all the way until end of June because the pollination will not get better until then.
Yeah, we had a story on Cron 4 News at 3 earlier this week about how people need to start their allergy medications sooner and take them longer because allergy season is just expanding. Are you seeing that with your patients?
Well, yes, because of the thunderstorm that we have a few months ago actually kick up the pollen. The pollination started earlier than normal. And starting the medication earlier do work better than starting it when you have full-blown symptoms.
Do your body start to build up tolerance to these medications? Do they at some point start to become ineffective?
I don't think it is really build up the tolerance to the medication. I think that your allergy might be getting worse, or the pollination is really high, making you having more symptoms. Not that you get used to the medication. That make it less effective. I think once allergy just getting worse, the medicine is not sufficient. They have to use stronger one, like a nasal steroid spray. And
what kind of symptoms are you seeing with people in your office? And are you seeing more people coming in complaining?
Oh yeah, a lot of people sometimes they think that they have a COVID infection, they feel like COVID, but it is not. It is allergies because they don't go away after a few weeks.
They think it's COVID, they think it's the flu or a cold, but how can you then determine the difference if it's not any of those diseases or illnesses and it is actually allergies that's making you sick?
Yeah, good question. I think yeah, be careful because sometimes with mild COVID, you might have allergy symptoms only. So the only way you can tell is just test yourself. If it's mild, you probably won't get into trouble. You just don't want to get other people into trouble.
So as we approach sort of the peak here of allergy season, do you have any advice of how we can kind of make it here through the end?
Use the medication and don't stop until end of June.
End of June. I got tissues right here. My crew listens to me sniffle and wipe my face the whole show. Dr. Schuman Tam with Marin Health, thank you so much for joining us here on Cron 4 News at 3.